Welcome to ACL Week. Let's go over the knee.
To better understand the ACL, we need to understand the structure of the knee. Let's go over the entire knee. At the bottom, we have the tibia, or the shin bone, which acts as the base. Outside is the fibula, which is a non-weight bearing bone. At top, we have the lateral and medial menisci, which acts as shock absorbers. Then we have the medial and lateral collateral ligaments, which gives us side-to-side support. Then the ACL, anterior cruciate ligament, which keeps the tibia from going forwards, and the posterior cruciate ligament keeps the tibia from going backwards. Inside the knee, we have the cartilage, which keeps the knee moving via a frictionless surface. And of course the femur, which is the longest bone in the body. Patella, or your kneecap, which provides greater leverage for your quadriceps to straighten out your knee. And that's the knee.